Hi, good morning. My name's Dr. Henry Dunn. I'm an ENT doctor from Cambridge, working in the Department for Clinical Neurosciences as well. And I'm grateful for this chance to talk to you about the role of wearables in falls, balance and gait assessment, and some of the work we've been doing to understand a clinician's perspectives and priorities in these assessments to hopefully support device development in the future. So today I'll try and cover the following points, including a bit of a background to falls and their importance, and the role of wearables in falls and potentially in the future, and then looking in detail about the study that we've carried out. So I don't need to labour this point. I'm sure you'll all be aware that falls are a significant burden in the NHS, with the financial and health burden for us all. And it's going to become a bigger problem with our ageing population. Falls assessments are complicated and multidisciplinary and multifactorial, and the National Institute of Healthcare recommend a comprehensive geriatric assessment as a gold standard. However, these comprehensive assessments have challenges and are difficult to deliver, and there's growing thought that potentially wearable devices may offer solutions to support better delivery of comprehensive geriatric assessments. Interestingly, although many devices are available commercially, very few have been integrated into healthcare pathways. Lots of studies have been done that show there's interest from patient populations, including the elderly patients, to use wearable technologies in the falls domain. However, looking in more detail, there's not very much information about what clinicians' priorities would be and what their attitudes are. So our study essentially aimed to establish those points in the domain of falls. Why this is relevant to an audiology conference is that patients who fall tend to be older, and they may well be wearing devices around their ears, and the ear does represent a useful monitoring location for various biophysiological signals, including head movements, and possible to extrapolate overall body movements. So can an Earable be leveraged to support falls assessment is a big question for our lab. So the methods of this particular study, we conducted a qualitative survey with open-ended questions that we initially piloted, and with several clinicians and experts who suggested to make the questions more open, and I've highlighted some of the questions below. We then used purposive sampling to run the questionnaire past several clinicians managing falls patients. We then did reflexive thematic analysis of the responses, and then carried out semi-structured interviews to get a deeper understanding of the themes that we've identified. Reflexive thematic analysis itself essentially represents a qualitative technique to extrapolate information from responses and present that to an audience. And this is the methods that we used, with multiple iterations of coding the responses into different themes, and then using those themes to identify meaning from the responses. We collected 26 responses from different healthcare professionals for the questionnaire, and we identified 6 key themes. And I'll just outline some of those themes here. So the first theme was that the history of falls is a key feature in a falls assessment. However, there was interesting finding that clinicians felt that often, despite it being so important, it's difficult to achieve a good history, be it that the patient who's fallen can't remember the fall because of the fall, or because of a preceding cognitive impairment. And that dichotomy represents an area of interest for device developers. If your wearable device can identify a fall or a near fall event, combined with its ability to collect accurate information about the patient's physiology at the time, it would be of interest to clinicians. Another theme was obtaining ecologically valid data is crucial for a good falls assessment. And again, clinicians mentioned this as the gold standard, but there's lots of challenges in terms of getting to a patient's house, as well as getting them to actually act as they would in their real-world environment while they're being observed by a clinician. Equally, the responses emphasise the importance of measuring changes over time, and on both of these points you can see where a wearable capturing objective data related to gait and balance in the real world environment and at multiple time points would offer healthcare professionals a tool that can provide them some information to support their comprehensive assessments. Our responses also highlighted the importance of a multidisciplinary approach to falls assessments, with patients often being referred to specialist services for assessments of a specific system. And we felt that wearables can potentially collect data and measure some of these systems, for example, 24-hour ECG tapes or blood pressure measurements. And therefore it follows that if a wearable device is to be used in the falls domain, it should be able to record parameters related to all the systems involved in a comprehensive geriatric assessment, and that would support an MDT approach. The responses also highlighted that clinicians were open to receiving more data, but only if that data was going to be useful for them, and particularly if it was related to modifiable risk factors, so it would be useful for patients. One interesting feature within this theme was the fact that there's limitations related to current assessments and data for gait and balance, with very subjective measures being suggested and being used that tend not to be repeatable. And generally in the responses there was a surprising lack of emphasis on gait in a falls assessment. And this may be because data from these measurements are unfamiliar and not currently available for healthcare practitioners, but also some of our respondents failed to recognise that some gait abnormalities do represent modifiable risk factors. So we suggest that if a wearable device was developed to provide objective gait information, it would be crucial that the information could be collected and displayed in a way that would be understood by clinicians. And there may well be a shift in learning required, and it would be really useful to work alongside clinicians when developing such a tool. It was acknowledged that collecting more information about patient can also have negative implications for both the patient and clinician. Clinicians highlighted concerns regarding workload as well as the responsibility around acting on the results. It'd be important to consider what safety measures would need to be put in place to support a patient if an abnormality was identified with a wearable device in the community. So, for example, if a problem was identified on day 1, who would be able to interpret it and act on it, and how much of a delay would there be? So safety measures need to be built into the device, but also threshold for significance would need to be carefully selected to prevent false positives and leading to increased workload for clinicians. So I think this is a really important area that needs to be examined. A final theme we identified was wearable literacy, essentially recognising that falls practitioners and healthcare professionals working in falls tend to have limited understanding of what's possible and what is available at the moment and in the future regarding wearables. And there'll need to be a good deal of communication between device developers and clinicians in order to establish this. Here's just a table that identifies some of the parameters that some of the responses referred to that could be interesting and useful for their falls assessments. And in conclusion, we found that falls assessments are complex and not always perfect. We highlighted key parameters of a falls assessment. We identified area where data collected by wearable could be useful, particularly ecologically valid data and contemporaneous data associated with modifiable risk factors. We highlighted risks that more data could lead to more unnecessary work, and a collaborative approach to device design is required with patients and clinicians. Thanks very much to our PPIE group members, to the Sense Lab team that I've been working with, and to the BRC Advanced Therapies and Devices Fund. Many thanks.